Okay. So we have here the Chief of Center for Muambong Integrated Health Center, who is going to tell us the impact of the surgical intervention that the association had partnered with him to do in the health facility. So we shall get from the COC.
Yeah, my name is Mr. Kane Dennis. I'm the COC of Muambong Integrated Health Center, and I've worked here for almost getting to 4 years now. And most recently, we started having an intervention here that had never been before. And I think the intervention have actually benefited the community and even the experience of the personnel here on site. I want to remark that the intervention has made even the poor to maybe have the services that they never thought they may have. Because when I came here, during our outreach activities, I discovered cases of hernia, appendix, hydrocele, and stuff like that that I had been referring to other hospitals, like our referral hospital, like District Hospital of Bangem, but due to financial difficulties, some of these patients has never turned up to go. And thank God that when Dr. Ako came in place and he was transferred to Bangor as a district medical officer, and with the FALCOH Low Cost Health Care Foundation that he partnered with, I think we started something like an outreach activity where my center was like a base of reference. So during this time, most of the cases that I had referred and the people never turn up to go to the hospital for surgery due to financial inconveniences, and sometimes the person who may even assist them while they are there, the relatives. I think this time around, most of these cases turn up, and the appreciation goes to the FALCOH Low Cost Foundation and Dr. Ako in particular for being carrying out this surgery, and the surgery has been much successful. We started surgeries here in April. The first surgeon was operation was done on, I think, 6th of April, where we had we had 2 appendectomy and 1 hernia. And since then, the inflow of the patient in the hospital and even out of the health area has drastically increased. And all the time now, sometimes we have operations on week basis, sometimes 2 week basis. As the need arises, I also make the call, and the surgeon is always there when the need comes. So I want to say that this intervention has helped the community in particular and helped the health area in general and even the district, because the operation is not restricted only within the health area. Patient coming within the health area, it also goes beyond, because patient come from Tombe health area who uses the health center. Patient come from Kak health area and even Manju health area that have been operated here. And due to the low cost of it, people have actually realized a lot of benefits. And looking at the fact that somebody going at a distance, the relative who would have even stayed with you will feel inconveniences, but back home here, the people are very happy because the care is there, everything is there. So I want to say that it has improved a lot of things, both in the economic of the health area and the persons within the area.